Welcome back. Hang on, hang on. There it is. 132/92. All right. Well, I mentioned recently at the top of the show that I found a new doctor at Virginia Mason, and after a few tests, she's asked me to, monitor my blood pressure. It's a bit high, so this little piece of equipment has found a new spot in our home and studio here, as I also consider some lifestyle changes, because over time we know that high blood pressure, which is called the silent killer, can lead to heart disease, and heart disease is the leading cause of death in women. So here to share more about keeping our hearts healthy, our board-certified cardiologist, Dr. Heidi Neiswarmer, and Dr. Anuradha Kalluru. Thank you so much for being here.
Thank you.
I gotta say, we know heart disease is a killer, literally, but are we still not understanding enough when it comes to heart disease in women?
Yes, heart disease is the #1 killer, but only 56% of the women recognize that heart disease is the leading cause of the death. They still think it's cancer. More women than men die each year from heart attack, and heart disease affects women of all ages, and the risk triples after menopause and overtakes men in 6th decade. Yeah, so this is just not men's disease. Heart disease affects everyone.
Okay.
And there are certain heart problems which are very common in women, like broken heart syndrome, stress-induced cardiomyopathy, small vessel disease, autoimmune disease, and spasm of the blood vessels.
Oh, man.
Pregnancy also has effects on heart. Some women have adverse pregnancy outcomes like gestational diabetes, preterm, hypertension, postpartum cardiomyopathy, or peripartum cardiomyopathy. Cancer and cancer-related therapies can also affect the heart, especially breast cancer, which is the most common cancer in women.
You know, it's interesting because I feel like over the years, there's this misconception that heart disease was a man's issue. But when you say that and you mention all those things, my goodness, it's no wonder that more women are dying from this. So Heidi, let's talk about prevention and lifestyle for a moment. What can a woman do to reduce their risk of heart disease? I'm not just asking for a friend, it's for me and all of us out here.
Sure. So I would say the first priority is stopping smoking, vaping, of course, as well, and really focusing on a heart-healthy diet. So we talk mostly about things like a Mediterranean-style diet or a low-sodium diet, especially important for hypertension. And even a plant-based diet would be ideal. And other things like routine exercise. So if you are exercising vigorously, you want to do about 75 minutes per week. That would be something like taking a hike or jogging.
Okay.
And moderate activity up to about 150 minutes a week. That's just like a brisk walk.
Okay. And so managing stress, though, and sleeping is also important, I hear?
Definitely. So managing stress, trying to reduce it. We all have stress, but trying to do your best to combat that. And ideally trying to sleep anywhere between 7 and 9 hours a day or a night. All of us need different amounts, but that's a good average to think about.
One thing I have here in my notes, because I was really shocked about this, excessive drinking. I didn't realize, I mean, obviously that's not good for anyone, but I didn't realize that played a role specifically in heart disease.
Sure. So it can increase blood pressure, for example, and in excessive amounts can actually be toxic to the heart, leading to a lot of the conditions we're thinking about here.
Okay. Anu, what are some of the symptoms that women should look out for? What are the things that are most alarming and maybe some of the more hidden symptoms?
Okay. So most common heart problem is the blockage of the blood vessels of the heart. And if it happens suddenly, it's called heart attack. And there are some typical warning symptoms like pain, pressure, squeezing sensation in the center of the chest.
Okay.
And sometimes you can have pain in your arms, neck, jaw, back, stomach, and some difficulty in breathing, dizziness, palpitations. But women have less typical symptoms than men.
Yeah.
And they also have, less chest pain compared to men when they have heart attack. They have vague symptoms like not feeling well, extremely tired, flu-like symptoms, having a stomach upset, and they just think they're just getting old or tired or stressed or not having enough sleep. And they delay in, medical attention. And as a result, delay in care leads to poor prognosis in women. So if you have any symptoms or you're concerned about any symptoms, don't wait.
Okay.
Just see your doctor or call 911.
Because that's the thing is that, I think a lot of us, we're like, oh, my neck hurts again or my back hurts again. I mean, when do you know it's time to call the doctor? Just better be safe than sorry. I mean, a lot of women were like, suck it up. We don't want to be over dramatic. but that can lead to death, right?
Right. I mean, if these symptoms are persistent and you don't know what's going on, and it is, impairing your day-to-day activity, which you're used to do and you're not able to do, so you should get an expert opinion rather than self-diagnosing at home.
Okay, yes, that's always that's always good advice. Heidi, many people think a heart is a heart. You think of a cardiology department and it covers everyone, but how does your hospital prioritize women's heart health?
Sure. So it's important to say that all of our cardiologists are really sensitive to some of these issues unique to women. So the presentation being a little bit different, and also looking for specific risk factors that affect women predominantly. But we also have some special programs that really focus on women's heart health. We have a collaboration between our obstetrics group, which is something we call the Postpartum Wellness and Recovery Program.
That's amazing.
And it's intended to look for women who've had complications in pregnancy, like preeclampsia, and impact their heart health sooner than later.
Got it.
And then we also have a program where we routinely monitor and treat women who've had cancer-related treatments that can impact heart health.
Okay. And last question really quickly, Anu. What can women do if they want to take charge of their heart health? What do I do? I mean, I'm making an appointment with y'all later today, but...
Well, I would say just know your ABCDs and numbers, which means A means ask your doctor about your risk for heart disease, identify your family history, risk factors, appropriate diagnostic screening tests, blood pressure control, cholesterol control, diabetes, and E for eating healthy, exercise, and educating, learn CPR. And if you have any symptoms, don't wait. Just see your doctor.
I love it. Thank you both so much.
Same.
I am so grateful for you taking the time today to come out here and chat with us. And for
Thank
more
you.
information on heart health, from diagnosis to treatment, you can visit Virginia Mason Franciscan Health at the website you see on your screen. Go check it out.
This special presentation of New Day Northwest, sponsored by Virginia Mason Franciscan Health.